Welding flash. Welder's flash is the result of staring or inadvertently looking at the intense light caused during metal welding while not wearing the correct eye protection. 1. Lay the casualty on the back with head and shoulders slightly raised. Keep the casualty quiet and still. Advise the casualty not to move or rub the eyes. Gently wash the eyes with sterile saline, or if not available, clean water, allowing the fluid to drain away from the eye. 2. Cover the eyes. Reassure the casualty. To prevent movement, place eye pads, dressings, or a clean cloth over both eyes and secure lightly. Explain that covering both eyes helps prevent movement of the injured eye. 3. Seek medical assistance. Spinal injuries. The symptoms of spinal injuries are severe pain in the neck or back, loss of feeling or movement, tingling sensation in arms or legs, inability to move fingers, wrists, toes or ankles, tenderness at the injury site, difficulty in breathing, shock. Caution. Where a spinal injury is suspected and the casualty is unconscious, the casualty must still be turned on the side to maintain an open airway. 1. Control bleeding. 2. Immobilise the casualty. Treat gently and with great care. Reassure and calm the casualty. Warm the casualty against moving. Support the head with your hands so there is no movement. Stabilise with a cervical collar. Improvise using a folded towel, newspaper, clothing or sandbags. Use blankets, towels, pillows or other clothing to support the shoulders and pelvis against movement. Use a soft padding between the legs and tie the legs together. 3. If the injury has occurred in water, do not remove the casualty from the water unless unconscious or in danger. Seek medical assistance immediately to immobilise the casualty before removal from the water. Use a flotation board to support the casualty in the water. 4. Seek medical assistance. While waiting for assistance, monitor the ABCs and level of consciousness. 5. If the casualty must be moved. Caution. Do not move the casualty unnecessarily. However, if you need to move the casualty out of danger, do so as carefully as the situation allows. Do not allow sideways or forward movement of the head and neck. Do not give food or fluids. Protect from temperature extremes. Place a light cover over the casualty, but do not overheat. Caution. Use at least 3 to 4 people to lift the casualty. Use a stretcher. Head injuries. What to look for? Brief loss of consciousness, drowsiness, headache, nausea, vomiting, blurred vision, loss of memory, particularly of the incident, loss of coordination, irritability, confusion, tingling, numbness and weakness in the limbs, bleeding or clear fluid from the nose, ears or into the eyes, pupils of unequal size or dilated, noisy breathing, twitching, seizures, unconsciousness. Caution. If the casualty is or becomes unconscious, place the injured side downward. A casualty with a head injury may also have a spinal injury. Support head and neck during movement. 1. Control severe bleeding. Cover any wound with a clean dressing and bandage, ensuring minimal movement of the head and neck. Caution. If you suspect a skull fracture, do not apply pressure to the injured area. 2. Immobilise the casualty's neck. Serious head injury must be supported with a cervical collar. Improvise using a folded towel, newspaper or clothing. 3. Assist the casualty into a comfortable position with head and shoulders raised. Support head and neck during movement. 4. Treat to minimise shock. 5. Seek medical assistance. While waiting for assistance, monitor the ABCs and level of consciousness. Caution. The casualty should always be examined by a doctor as soon as possible after the injury. Complications may occur many days after the incident. Medical assistance must be urgently obtained if any of the signs or symptoms from what to look for appear. Do not leave the casualty unattended. Ear injuries. Ear injuries should be treated similarly to all head injuries. However, injuries to the ear usually affect the hearing function rather than balance. Children are especially at risk of ear damage by inserting small objects into the ear canal. An old but sensible saying is that nothing smaller than an elbow should be poked in the ear. If you find an ear obstruction, for example an insect, attempt to float it out with warm water or clean light vegetable oil. If object is immovable, seek medical aid. Poking into the ear should be avoided. Ruptured eardrum. Place cover over affected ear to guard against infection. Seek medical aid. Avoid using eardrops unless directed by a doctor. Avoid swimming or water sports. Near drowning. The most important consequence of drowning is interruption of the oxygen supply to the brain. Early rescue and resuscitation are the major factors in survival. There are many different events that lead to a person drowning. Some of these are immersion of the face in water or other liquid, breath holding, swallowing of air and water, often in large amounts. This usually causes vomiting or regurgitation. In most victims, laryngeal spasms relax after loss of consciousness and water and vomit may be then drawn into the lungs. Victims of drowning are rolled onto their side during the initial checking and potential clearing of the airway. For ease of management, the rescuer should check for breathing whilst the patient is in the side position. This is to stop the multiple rolling of the person onto their side should breathing be present. In all victims, even where laryngeal spasms persist, it is important to ensure that the basic requirements for airway care are met, including clearing of the airway to remove any foreign material. The administration of oxygen is particularly beneficial in attempted resuscitation of the apparently drowned, but resuscitation efforts should not be delayed while waiting for oxygen equipment to become available. EpiPen, EpiPen and EpiPen Junior are preloaded syringes that inject a single dose of adrenaline for the emergency treatment of adults and children who experience severe and potentially life-threatening allergic reactions. For example, anaphylaxis or allergic shock. Signs and symptoms can include skin rash, hives, itching, swelling, wheezing, difficulty breathing and collapse. To use an EpiPen, follow these steps. Remove from the carrier tube. Hold the EpiPen in your fist, ensuring your fingers and thumb are away from either end. Remove the safety cap and hold the black end to the outer mid-thigh and push firmly. An EpiPen can be given through clothing. A click will be heard and you may feel a rebound effect as the needle injects the medicine. Hold the EpiPen in place for 10 seconds. Remove and rub the thigh for around 10 seconds to assist absorption of the medicine. Place the EpiPen back in the carrier tube. Call an ambulance and record the time the EpiPen was given.
Communicate details of the incident.
If there is more than one first aider, one person should call the ambulance whilst the other begins resuscitation. If you're the only person present and the person needs CPR or EAR, administer first aid, then call an ambulance. Emergency services will require the following information: the exact address or location of the emergency, the name of the street, city or town and the names of nearby crossroads, landmarks, the level, room numbers, the best entry. Consider that the ambulance officer may have to roll the victim out on a stretcher. The caller's name and phone number, what type of incident occurred, e.g. a stabbing, pass out, punch to the face, how many victims, assessment of the victim, e.g. chest pain, no pulse, severe bleeding, and what first aid has been given. If you instruct someone else to make the call, tell the caller to not hang up until the operator does. Tell the caller to report to you after making the call and tell you what the operator said. The operator may give instructions on what to do until the ambulance arrives. Occupational Health and Safety. The Occupational Health and Safety Act outlines employee duties and responsibilities with regards to administering first aid. These guidelines are included in your workbook. Take a moment now to look up these guidelines and familiarise yourself with your responsibilities as a first aider.